Yes, talking about primary prevention, that is in the first case itself, that not to get into the illness. So, primary prevention is installing good health habit and changing poor ones in the task of is the task of primary prevention. So, that is installing some of the good health behaviors, and we can change the poor habits or poor health behaviors that is followed by that person, and it is called a task of primary prevention. This means taking measures to combat risk factors for illness before an illness has a chance to develop. So that is taking care of some of the measures to avoid the illness and not to make a chance to develop of that illness. For example, the primary prevention that we people are taking today for against the coronavirus or COVID-19, that we are taking care of the risk factors, like uh, we are taking some of the factors like social distancing, wearing mask, or using of sanitizers, and some other washing our hands before or after when we are coming back to home. So these all are some of the measures we have to take care not to get into the illness. And there are two general strategies for primary prevention. The first and the first and most common strategy is to get people to alter their problematic health behavior, such as helping people lose weight through an intervention. And the second one, more recent approach, is to keep people from developing poor health habit in the first place. An example of this approach that we can see that smoking prevention programs with young adolescents that we are conducting today to be avoid and keep people from developing these poor health behaviors. That is the first thing that people have to do. Practicing and changing health behaviors. An overview, we can see that we have to follow some of the practices, and we can automatically change the health behaviors. And what are the factors, or what factors lead one person to live a healthy life and another to compromise his or her health, and what are the factors leading to a person to live healthy and to compromise his or her healthy. And the first one, there are some factors we can see here, that like demographic factors and age of the person and values of the person and personal control, social influence, knowledge and intelligence, personal goals and values, access to healthcare system. So these all are the factors that lead the person to live a healthy life and to compromise with his or her life. So we'll discuss uh, the points or the factors one by one in the upcoming slides. Yes, there are some barriers to modifying poor health behaviors. So when talking about some of the barriers related to relating to making a good health behaviors, there will be some factors like there will be some barriers to that or to modify our behavior. That is the first one, that is the emotional factors. So we know that emotional factors will be always will give some of the pleasurable to be pleasure to the person. So emotions may lead to or perpetuate unhealthy behaviors. So most probably these emotions are leading the persons to unhealthy behavior or to perpetuate these unhealthy behaviors. These behaviors can be pleasurable, automatic, addictive, and resistant to change. So it is somewhat difficult to get back from these emotional factors, like because it gives pleasure to the person, that behavior gives pleasure to the person, so automatically it is feeling getting into difficult to come back from that. And automatic, it is automatic in nature, and someone goes addictive to the behavior, and it is they feel to come back from that, sometimes resilience is not possible with that person. So that any kind of messages or threatening messages can sometimes designed to change health behaviors can produce psychological distress. So when making any messages over this or designing some of the messages over this, it can make or designed to change health behaviors can produce any psychological distress, and it will lead people to respond defensively, distorting risk to their health. So sometimes it will make a psychological distress when you are trying to change that person or people to from that, because the person is facing some emotional factors, and it will lead the people to respond with an defensive manner, and it will distorting risk to their health also. Other barrier in the modifying the health behaviors, uh, modifying the poor health behaviors, that is the other factor is instability of health behaviors. So health habits are only modestly related to each other. The person who exercises faithfully does not necessarily wear a seat belt, that is for example, and therefore health behaviors must often be tackled one at a time. Health habits are unstable over time, and a person may stop smoking for a year but take it up again during a period of high stress came to that person. So health habits are only modestly related to each other. The person, we know that the person who exercises faithfully does not sometimes, he may not be going for taking the other health habit or health behavior, something related to driving the vehicle, like sometimes he may not be bother about wearing a seat belt. So some of the factors are related, some of the habits are related to each other, and that there you can feel that there you can feel a instability with that instability of the behavior. And the person who are following better health habits, we can say that it is unstable over time. Sometimes it can be get changed, that health habits can be get changed. So a person can modify their health habit, and there comes the barrier. So when a person may stop smoking for a year but he will take it up again during a period of high stress game, so that is a instability of the health behavior can will make a barrier to modifying the poor health behavior.